A woman giving birth to a child has pain because her time has come. But when her baby is born, she forgets the anguish because of her joy that the child is born into the world. I guess this passage is true, and all mothers would attest about their experiences in giving birth to a child. And they would really say that that is a lot of pain, agony, and the burden that they have to bear. But it is beyond the joy and the fulfillment upon seeing their newborns.
Indeed, when a woman gets pregnant, a lot of time and energy is focused on how to help them with their nutrition, exercise, rest, and more so they can be at their healthiest. However, once the baby comes home, the focus tends to turn toward the baby and not so much on the mother, who has gone through a lot from the beginning of the process of pregnancy to labor up to delivery.
Which is why I believe that we should shift our attention to the possible complications the postpartum mother might encounter when left ignored and neglected. Let us discuss postpartum infections and its dangers.
That is a worthwhile topic. Whether a woman had a normal spontaneous delivery or cesarean section, if she has been exposed to certain pathogens, she would be at high risk of developing postpartum infections, such as surgical site infections, endometritis, episiotomy infections, septic pelvic thrombophlebitis, mastitis, urinary tract infections, epidural abscess, peritonitis, and others that are all associated with substantial maternal morbidity and mortality. All these not only create physical, medical, and mental inconveniences, hence even pose financial, social, and emotional burdens to mothers, their families, and even to their communities.
Postpartum infections will definitely lead to more severe complications resulting in systematic inflammatory response syndrome, sepsis, and worse, it would be irreversible disabilities and even death when left undiagnosed or untreated. So, as a member of the community that cares and as a student nurse that aspires to give care, what can we do?
Healthcare providers should observe aseptic and sterile techniques at all times to make sure that they will not be compromising the health of their patients. They should also emphasize the importance of complying to proper regimens like antiviral and antibiotic prophylaxis to prevent antibiotic resistance, as well as to maintain intact surgical site or perineum by teaching proper wound care. We should also watch out for the signs and symptoms of these infections and educate our clients for awareness. Fever, pain, uterine or localized tenderness, bleeding and foul-smelling discharges, breast engorgement, and other untoward symptoms should not be ignored and neglected specifically and most especially by the postpartum client.
That is a truly empowering information that you have shared. And as a woman and as a mother, having been aware about the fatal risks and consequences of postpartum infections, this should really give a wake up call to all mothers out there for them to take charge of their health and their welfare. And of course, for the sake of our children and for the sake of our family, we should really take no hesitation to seek consultation and treatment when needed. Remember that healthy moms creates healthy babies and healthy family in the communities. It is really nice to know that there is a community out there who would truly care. This is a call for action to prevent infections for mothers who gave birth. Together, let us promote a community that cares.